Namaskar, hello, and welcome back to our channel. And we're going to deep dive into Materia Medica once again. I'm sorry for not being able to post in the last few months. I've been quite busy, but we're going to start it all again now. Okay, so today it's going to be a very special video. First of all, it will be a differentiation video, a comparative materia medica related video. And another special thing about this video is that it's going to be led by my sister. So my sister is going to talk about the differentiation between digitalis and cactus. She is also doing homeopathy itself. Okay, so comparative materia medica is actually a very important way to study materia medica by comparing the remedies, because in that way we understand the remedies in detail and clinically as well, because when the patient comes to us, we tend to think about different remedies, right? Because if the patient has come to us with any complaint, for example, now just heart complaint, right? Then you'll be thinking about various different remedies that are used in heart complaints, and you have to clinically differentiate them in order to prescribe one of them. So a very important aspect of materia medica is to be able to compare between the remedies and not just understand one remedy in detail. So we've been understanding one remedy in detail since since a long time. That's how we were doing our videos. But now we are also starting this new thing in which whenever possible we're going to try and make videos in comparative materia medica, which will make it very easy for us to be able to differentiate when we are in the clinic. And another thing is that when anybody who is in college, especially in second year, has this definite question in their syllabus, which is comparison between digitalis and cactus for heart disorders, or comparative questions, right? So it's going to be helpful for them as well. So let's start this video. My sister is going to take it as I told you, and I'm sure you'll love it.
Okay, let's start with the differentiation between the Digitalis and Cactus grandiflorus. I have taken down these notes from N.M. Chaudhary and Dr. Boric, Materia Medica. So, firstly, I'll talk about the notes that I have taken down from N.M. Chaudhary, and then we'll go on to Dr. Boric's Materia Medica. So, the common name and the family name of Digitalis, the first differentiation point that we see is that common name is foxgloves and the family name is Crophulariaceae. In Cactus grandiflorus, the common name is night blooming ciris and the family name is Cactaceae. The first thing that we're going to talk about in this differentiation is the action. Both of them acts on heart but differently, because digitalis will act on the centers of the heart. Okay, it will act on the systole and the diastole. But how will it? Because it is going to prolong the diastole and it is going to strengthen the systole. But how is it going to do that? So it will act on the vagal nerve by prolonging the diastole. We know diastole is relaxation, so it will prolong the diastole by acting on vagal nerve. Also, it will act on systole by strengthening the contraction. Now, how will it do it? It will act on the cardiac ganglia. Okay, by acting on cardiac ganglia, it will strengthen the contractions, that is the systole. Alright, this is how the digitalis will act on the centers of the heart. The other thing that we see is in the cactus. Now, what is cactus going to do? Cactus is going to increase the blood pressure. But how? Again, it will act on nerves. It will act on the nerves by quickening and strengthening the beat and thus increasing the heartbeat. Okay, this is all about the action of the digitalis and Cactus grandiflorus. Now we talk about the peculiarity that the digitalis and Cactus grandiflorus shows on the heart. In digitalis, we have only two sensations. First is that there is a sensation as if the heart would stop beating if she moved. So moved, stopped. The heart stops to beat. Okay, so there's this sensation as if the heart would stop beating if she moved, which is reverse in Gelsemium, because in Gelsemium we see that if she does not move, she feels that her heart will stop beating. Right, so this is the first peculiarity that we see in digitalis. The another one, that there is sinking and faintness at the stomach. There is this feeling that there is sinking and faintness in the stomach, which is associated with deadly nausea. Alright, these are the two sensations we see in digitalis. But in Cactus grandiflorus, there are more than two sensations that we see. The first is that the whole body feels as if caged, and each wire being twisted tighter and tighter around him. Okay, so this is the first sensation that they have. Another sensation is that there is constriction as a generalized symptom in this remedy, that there is constriction. So this also can be reflected in the heart complaints. In the heart as well, there is this constriction, there is this sensation of constriction, and because of this constriction, like it is constricted by an ion band which prevents its normal movement. So there's a sensation that the heart is constricted by an ion band preventing its normal movement. Another one is that there is this very important constriction in the operation of the chest that we see. All right, this because of this oppression which is felt at the lower part of the chest. Peculiarities that we see in digitalis as well as Cactus grandiflorus are, now what we see in digitalis, there are only two peculiarities that we see, but in Cactus grandiflorus there are more than two kinds of sensations or peculiarities that we see that revolve around the heart. Alright, so in digitalis, what we see is that there is a sensation as if the heart would stop beating if she moved. So if she moved, the heart would stop beating. So this is a kind of sensation, peculiarity that we see in digitalis, which is reverse in Gelsemium. Because in Gelsemium, what we see is that the heart would stop beating if she does not move. Right. The another point in the peculiarity that we see in this is that there is a faintness and sinking at the stomach associated with deadly nausea. So there's deadly nausea and sinking or faintness kind of a feeling in the stomach. These are the two sensations that we see in digitalis. Now we come up to Cactus grandiflorus. Alright, in Cactus grandiflorus, what we see is that there is a sensation as if the whole body is in cage. So whole body feels as if caged, each wire being twisted tighter and tighter around their body. Okay, this is a peculiar sensation that we see. Another sensation that we see is that there is this constriction of the heart. Constriction is a generalized symptom that we find in Cactus grandiflorus. A remedy that we see is that there is a constriction everywhere in the body. So we can also see it in association with this heart. There's constriction in the heart as well. So a sensation of constriction in the heart as if an iron band prevented its normal movement. So there's a feeling. All right. Another thing that we see in this remedy is that there is oppression of the chest. Now, why is this oppression present? It is because of this sensation of cord, which is tightly around the lower part of the chest. Alright, so the oppression of the chest is because of this cord, which is tied at the lower part of the chest. Okay, the another thing that we see in this remedy, the another peculiarity that we see is, okay, the heart feels as if clasped and unclasped by an iron hand. This is an hand, iron hand. And because of this, the heart feels that it has no room to beat. How is it going to beat? Because it has been clasped and unclasped by an hand. So the heart feels as if clasped and unclasped rapidly by an iron hand as if bound and has no room to beat. These are the peculiar sensations that we see in both of the remedies. Clinically, what we see in digitalis and Cactus grandiflorus. The first thing that we see is that the pulse is very weak, it's very irregular, and it's very slow, which intermeets every third, fifth, and seventh beat. So it will come up every fifth, third, and seventh beat. Right. The another thing that we see in digitalis is that there's dropsy. This dropsy is because of the cardiac origin. We see that the heart is not working properly. So because of this, there is circulatory issues. The blood is not it is not being able to reach to the every body parts, and this creates a lot of problem. Because of this, blood stagnates at the region, and because of this stagnated blood, what happens is that there is formation of edema. So because of this, there is dropsy. Because of cardiac origin, there is dropsy. The another thing that we see is flushes of heat. All right, again, this is because of the circulatory issues. The another thing that we again see is that there is enlargement of the liver. The liver becomes enlarged and becomes sluggish, very slow. It works very slowly. There is jaundice and clay colored stools because of this jaundice. The another thing is there is cyanosis, that is blueness that we see, and in the eyelids, in the lips, in the tongue, and in the skin. So there's blueness all over the body. There's distended veins that we see on the lids, on the lips, and on the tongue, and on the ears. This is because of the issues in the circulation. Right, now we come up to Cactus grandiflorus. Right, now in Cactus grandiflorus, what we see is that there's palpitations day and night. So there will be palpitation which is aggravated even if she walks, even if lying on the left side. Okay, at approach of menses, all these things will aggravate this palpitation which is happening day and night. Okay, another point, we see that normally in every heart disease, because the heart is not pumping the blood properly, this makes the blood reaches the extremities in a low amount. This is because it is not able to pump properly. So this makes it cold. So extremities become cold and there is weakness associated with it. Hemorrhage is another very generalized point that we see in Cactus grandiflorus. Like we all have seen earlier, that constriction is something which is generally present, like a general symptom in that remedy. Again, we see that hemorrhage is also a very general point, general symptom that is present throughout this remedy. So there is hemorrhage from every orifice that we see. All right. So these were the clinicals that we talked about. Now we will talk about the clinical pointers which are given by Dr. Boric. Now, everything that we talked about from the start was taken from Dr. N.M. Chowdhury. Now we will talk about Dr. Boric, but before that, I want just to revise it quickly. So first point that we saw was about the action, second was about the peculiarities, and the third was about clinicals that we saw. So action, we saw that Digitalis acts on the centers, that is systole and diastole, while Cactus acts on the nerves by increasing the BP. So it will act on nerves and increase the BP. Right, this was the first point that we talked about. Then we talked about the peculiarities that we see. We saw that there are only two peculiarities, that if she moves, there is the sensation as if the heart would stop beating. Another is that there is a faintness or sinking of the stomach with deadly nausea. These were the two points or peculiarities that we talked about in Digitalis. The another what we saw about in Cactus was that the whole body feels as if caged and each wire being twisted tighter and tighter. Also, there is a constriction, sensation of constriction in the heart. Because it doesn't also it doesn't it because of this iron band, the normal movement is prevented. We saw the oppression of the chest at the lower part of the chest, and we saw that this chest feels as if collapsed and unclasped rapidly by an iron hand. Right, these were only the points that we talked about in peculiarity. Clinically, what we saw, that it was because of there is pulse, what we talked about, that it becomes weak, irregular, and blah blah. Right, then another point we talked about was the dropsy, the flushes of the heat, then enlarged liver, then cyanosis and distended veins. In Cactus grandiflorus, we talked about the palpitation which is present day and night, and its aggravation, the common symptom, that is weakness and coldness of extremities, and a very general feature that is present in Cactus, that is hemorrhage. Hey, that's it. Now we'll talk about the clinical pointers. Clinical pointers by Dr. Boric are from the Digitalis and Cactus. So in Digitalis, we see that it acts on myocardium when there is dilation of myocardium and weakness, so we can use it then. It is also useful when the heart is not able to compensate. So there is failure of compensation, and especially when auricular fibrillation has set in. Auricular fibrillation is this rapid, irregular, unsynchronized contraction of the muscle fibers, and because of this there is failure in compensation. So it can be used in when there is this problem in the heart. Another thing is whenever a patient comes to you and you check the pulse, so when he is lying down, okay, lying down, when you check the pulse will be slow, okay, in a recumbent position. Okay, recumbent position is either he is sleeping on his back or on the stomach or sideways, whatever it is, the pulse will be slow. But once he sits up, you see that the pulse becomes dicortic. Okay, another thing is that there is post-rheumatic fever for auricular flutter and fibrillation. So we can use it after rheumatic fever has set in, right? So then we see that cardiac irritability and ocular troubles after tobacco. So once the patient if takes tobacco and there is problems with the eyes or with the cardiac, that is the heart, we can give this remedy along with all the other indications that we've already discussed. Right. Now we come to Cactus grandiflorus. In Cactus grandiflorus, we see that it can be used when there is atheromas in the arteries and weak heart. Okay, there's great periodicity that we see in this remedy. It also is a very good remedy which can favor the formation of clots. Okay, it is used in toxic goiter when there is problems with the thyroid, with the cardiac symptoms that we've already discussed before. It acts best in cardiac impotence. That is the first stage when there is problems or troubles with the heart. We can use it. A very good remedy. Endocarditis with mitral insufficiency. There is endocarditis. We know that there are three layers of the heart: endocarditis, pericarditis. Not carditis. It is endocardium, pericardium, and myocardium. So there is problem with the endocardium, that there is inflammation in it. So there is endocarditis we can treat with the mitral insufficiency. There is inflammation of endocardium along with mitral insufficiency. That is valvular problems of cardiac heart with violent and rapid action. So at that time the heart becomes very violent and rapid in action. Right. So that is when you can clinically use this, which is given by Dr. Boric. It is also useful in angina pectoris with all the general symptoms of the cactus, that is constriction, that is hemorrhage, and all the sensations that we have already covered. Now we'll come up to the modalities that we see in this remedy. Now the modalities that I will be talking about has been taken from Dr. Boger as well as from Dr. Boric. Alright. The aggravations that we see in digitalis given by Dr. Boger are rising up, exertion, heat, lying on the left side, motion, smell of the food, cold drinks, and sexual excess. These are the modalities, these are the aggravations that the remedy have, which is given by Dr. Boger. Now, Dr. Boric says when she is sitting erect, there are problems, he or she. There is problems after meals and music. So these are the aggravations that we see in digitalis. The aggravations again in Cactus grandiflorus are lying on the left side, which is also seen in this digitalis. So this is very common. But along with the left side, also when they're lying on the occiput, there is troubles. There is periodicity of the complaints, which we have already seen that Dr. Boric said that there is great periodicity in this remedy, which again we can see because of this periodicity, complaints coming up every year or every monthly, that is the periodicity that we aggravates their complaints. Again, exertion is present in both of them. Alright, then there is 10 to 11 a.m. or 11 p.m. aggravation, and there is aggravation at night. These are the aggravations given by Dr. Boger for Cactus grandiflorus. Dr. Boric says that they're worst in noon. The noon, they're worst. Walking, they're worst. Going upstairs, they're worst. Right, these are the symptoms, these are the aggravations of the remedies. Now we talk about the ameliorations. Both of them are ameliorated in open air. Okay, now we're talking about the digitalis. They're ameliorated at rest because exertion, if they're aggravated by exertion, it's obvious that they're going to be good or better when they're at rest. Then open air, cold air, they feel good. Lying flat or on back, not on the left side because left side aggravates their symptoms. So only on the back or on the front, or on the abdomen, they feel good. Also, Dr. Boric says when stomach is empty, they feel very good. We also have seen that there is a sensation in digitalis that there is faintness and sinking of the stomach with deadly nausea. So they feel very good when stomach is empty. Okay, then again we see that the amelioration in cactus grandiflorus is that ameliorated in open air and when there is pressure on the vortex. So here we complete the differentiation between digitalis and cactus. So this was all about the remedy. It is a very interesting remedy because you see that it acts on the heart, that is same organ for both of them, but produces different actions, different sensations, different uh, everything is very different. It has their peculiarities, own its own peculiarities. So it makes it very interesting and good. So I hope you understand what I have said and it has been helpful to you. Thank you.